Breaking news on Channel Ignite about the outbreak of tuberculosis in the Bahamas. My name is Elizabeth Moss, and today I'll be giving the history and brief background about TB. In 1720, for the first time, the infectious origin of TB was theorized by the English physician Benjamin Martin. Tuberculosis was one of the greatest plagues to hit Europe and North America during the 18th and 19th century. During this time, tuberculosis had reached epidemic proportions in Europe and North America. It had earned the name Captain among these men of death. Also, there was a huge debate wondering whether tuberculosis was an infectious disease or a hereditary one. In 1810, a French doctor by the name of Gaspard Laurent Vernet recognized tuberculosis not only as a disease affecting the lung, but a generalized one, clinically defined by coughing, difficulty in breathing, fever, and purulent expectoration, which is a large number of white blood cells, especially neutrophilic granulocytes. There are many scientists who carried out a vast variety of experiments to try and find the remedy for tuberculosis, but were unsuccessful, until a famous scientist by the name of Robert Koch was able to isolate the tubercle bacillus. Using the methylene blue staining recommended by Paul Ehrlich, he identified, isolated, and cultivated the bacillus in animal serum. Finally, he reproduced the disease by inoculating the bacillus into laboratory animals. On March 24, 1882, Robert Koch announced the discovery of Mycobacterium tuberculosis, which is the bacteria that causes tuberculosis. Years later, after this discovery, the Percat and Mantle tuberculin skin tests were made. Albert Comet and Camille Guerin, BCG vaccine, Selman Waxman streptomycin, and other anti-tuberculous drugs were developed. Now, let's go to Rachel with an important message.
Thank you, Elizabeth. I'm on the scene of Mercy's Crest Hospital where there has just been a reported outbreak of tuberculosis, or as they call it, TB. Good day. Today I will be talking to you about the causes of tuberculosis, or as they call it, TB. It is a disease caused by an airborne bacterium, and this bacterium is called Mycobacterium tuberculosis. When the person inhales the droplet nuclei containing M. tuberculosis, they then begin the process of being infected. The bacterium stays in the lungs and begins to grow and spread throughout the lungs. It is also spread from the lungs by going into the bloodstream, which would also allow for full infection of the entire body and could attack major and important critical organs such as the brain and the spinal cord. However, the disease in the lungs is the most dangerous and infectious means of housing the bacteria because it will be easily able to spread through its airborne ability. This will allow for potential hosts to be infected by this one infected person. This will allow for a massive spread of the disease. Possible symptoms include fatigue, weight loss, fever, night sweats, and lack of appetite. And specifically, in case of anybody being uncertain whether they may have these symptoms in the lungs for tuberculosis, coughing, chest pains, hepatitis known as coughing of the blood, painful breathing and coughs, and coughing up sputum, a mucus that is produced in the lungs. This is Rachel, and now I'll be passing it on to Tanika, who is standing by with ways to prevent the spread. Tanika?
Thank you, Rachel. Following today's top story, tuberculosis is one of the top 10 causes of death globally. This disease is an airborne bacterium. Prevention is key. Here are some ways to prevent tuberculosis. The likelihood of acquiring the TB bacteria greatly increases when you have low immunity and are in close contact with someone who has TB. A person's immunity can be compromised by illnesses like diabetes, silicosis, and HIV infection. Immunity can also be decreased by some medications used to treat other illnesses. Groups at risk: patients on dialysis, children under the age of 5, adults, and adolescents. You need to start receiving treatment immediately once you have active TB disease. This can entail using several drugs for 6 to 12 months. Even if you feel better, it's crucial to take all your medications as directed during the entire process. If you don't, it's a possible chance you might get sick again. You have what medical professionals refer to as latent TB. If you have TB bacteria in your body, but they haven't yet turned active, your physician might still advise you to take medication to prevent the bacteria from becoming active. During the first few weeks of therapy, or until your doctor declares you to no longer be contagious, follow these additional recommendations to help prevent others from contracting TB. Take all prescribed medications exactly as directed until your doctor tells you to stop using them. Maintain all your medical appointments. When you cough or sneeze, always cover your mouth with a tissue. Place the tissue in a plastic bag, seal it, and discard it. After sneezing or coughing, wash your hands. Do not invite someone to see you or pay you a visit. Avoid going to work, school, or other public areas. Please stay at home. To circulate fresh air, open windows, or use a fan. Use private transportation instead. Thank you, and back to you in the studio, Elizabeth.
Very informative, Tanika. Now let's head out to Tia with info about treatment and more.
If you have latent TB, your doctor might recommend treatment with medication if you're at higher risk for developing active TB. For active tuberculosis, you must take drugs for at least 6 to 9 months. The drug and the length of treatment may vary due to your age, overall health, possible drug resistance, and where the infection is in your body. With latent tuberculosis, you may only be required to take 1 or 2 types of drugs. Active tuberculosis, however, particularly if it is a drug-resistant strain, may require several drugs at once. The most commonly used drugs to treat tuberculosis include pyrazinamide, rifampin, and ethambutol. If you have a drug-resistant TB, a combination of antibiotics called fluoroquinolones and injectable medications such as capreomycin are generally used for 20 to 30 months. Some drugs might be added to counteract the drug resistance, such as phenylephrine. Serious side effects of TB drugs usually don't occur, but when they do, they can be extremely dangerous. All tuberculosis medications are toxic to your liver. Call your doctor immediately if you experience nausea or vomiting, loss of appetite, jaundice, dark urine, blurred vision, easy bruising, or bleeding. Completing treatment is essential. After a few weeks, you may not be contagious anymore, and you may start to feel better. But please, do not stop taking your TB drugs. You must finish the full course of therapy and take the medication exactly as prescribed by your doctor. Stopping treatment too soon or skipping doses can allow the bacteria that are still alive to become resistant to the drugs, leading to TB that is more dangerous and difficult to treat. The chest clinic is located in the pediatric corridor upstairs in the outpatient department of the Princess Margaret Hospital, open Friday, 8 a.m. to 1 p.m. They earnestly try to see all patients, whether walk-in or referral. Mantle testing is offered at the chest clinic every Monday through Friday, the medical corridor Wednesdays and Friday mornings, South Beach Clinic Monday through Wednesday. For more information, please contact the Tuberculosis Control Unit of the Department of Public Health, located in the Ponciana Hill Building on Meeting Street, Nassau. Telephone contact is 242-502-4728. Again, 242-502-4728. Operational hours are 9 a.m. to 5 p.m. Monday to Friday, except public holidays. Thank you for tuning in to Channel Ignite Breaking News Edition. Good night, everyone.